History of nursing. In this video, we will explore the history of nursing. As nursing students, it is important to understand the origins and roots of nursing, as it is this rich history that shapes nursing into the profession it is today. Let's get started. Drive for theory. Theories are important within the nursing profession because they allow nurses to provide consistent care. These theories assist the nursing profession to organize patient data, analyze patient data, recognize pertinent evidence in the data, understand patient data, make decisions based on evidence and understanding, plan patient care, predict patient outcomes, and evaluate patient outcomes. In 1859, the first nurse theorist was Florence Nightingale. Nightingale's theory suggested that the patient's environment could be used to assist in patient care and recovery. This theory is still used in patient care today. Nightingale linked health to fresh air and water, proper ventilation, efficient drainage, cleanliness, and light, particularly direct sunlight. She also emphasized the importance of keeping the patient warm, maintaining a noise-free environment, and being aware of the client's diet, which includes assessing intake, timeliness of the food, and its effect on the person. Canada's drive for theory started in the 1950s when nurse theorists wanted to separate themselves from other healthcare disciplines. They started to look at the scientific aspects of their profession. Using borrowed knowledge from other disciplines, they organized the concepts and disciplines that were more unique to the nursing profession. In 1960, the nursing process was developed. Today, we have different theories. They include practice-based, needs, interactionist, systems, and simultaneity. Problems developing theory. The objective of nursing theory is to organize an understanding about nursing in order to allow nurses to use it in an accountable and professional method. In regards to nursing theories, barriers in the development of theories included that nursing was not standardized, nor was it recognized as a legitimate profession. Before Florence Nightingale improved the standards of nursing, nurses, specifically in the 1800s, were described by physicians as dull, unobservant women. Of the best, it could only be said that they were kindly and careful and attentive in doing what they were told. The importance of nursing was overlooked. It was not considered to be a field of work, but rather something that was simply done within the home. Nursing science initially applied the knowledge of other disciplines, and nurses failed to see the importance of how their roles differed from those of other healthcare professionals. Changes in educational preparation. Throughout history, the educational preparation for nurses has changed and evolved. In 1860, Florence Nightingale established a financially independent school of nursing in association with St. Thomas's Hospital in London, England. Students provided free nursing services to the hospital in return for their education and living expenses. The early hospitals were stretched financially because they did not charge the poor any money for their services. Mary Agnes Snively was one of the first nurses to lead the way towards the change in nursing that we see today. She advocated for residences so that students didn't have to sleep in the hospitals. She also developed a nursing curriculum, which included nursing theory and practice, and she lengthened the educational period to 3 years, which included 84 hours of practical nursing and 119 hours of instruction by medical staff. St. Catherine's Training School was the first hospital diploma school in Canada and opened in 1874. Qualifications for students to attend the school were to have plain English education, good character, and Christian motives. By the 1930s, there were approximately 330 schools of nursing in Canada. Students learned chemistry, sanitary science, physiology, anatomy, and hygiene. They were also taught to observe patients for changes in temperature, skin condition, pulse, respirations, and function of organs. Jean Gunn worked to get registration for nurses and was also the first to envision nursing as a university degree program. Gunn played a vital role in implementing various courses into nursing education. She was involved in provincial, national, and international health and nursing organizations, and is best remembered for her role in establishing the Nurses' War Memorial, recognizing the service of military nurses during World War I. In Canada, from 1919 to 1959, nursing education continued to be refined. Courses in arts and science were combined with nursing courses to enhance student development. As the nursing program evolved over the years, the University of Toronto model became the dominant model for university nursing education in Canada. In 1959, the first master's degree program in nursing was established at the University of Western Ontario. In 1975, it was proposed that all new nursing graduates be qualified with a bachelor's degree. In 1991, the first doctoral nursing program was established at the University of Alberta Faculty of Nursing. Today, there are 12 doctoral nursing programs in Canada. In today's nursing, there are many continuing education classes offered to help nurses learn current nursing skills, knowledge, and theory. Continuing education includes formal, organized, and educational programs offered by provincial associations and educational and healthcare institutions. Development of nursing associations. The development of nursing associations help to regulate the profession by setting educational standards, outlining the scope of nursing practice, and improving quality of nursing care. In Ontario, there are 3 main associations that a registered nurse may be affiliated with: the CNO, the CNA, and the RNAO. The College of Nurses of Ontario, also known as CNO, is the governing body for 153,000 registered nurses, registered practical nurses, and nurse practitioners practicing in Ontario. The nursing profession has been self-regulated in Ontario since 1963. The CNO regulates nursing to protect the public interest and sets requirements to enter the profession, establishes and enforces standards of nursing practice, and assures the continuing competence of nurses. In order for registered nurses, registered practical nurses, or nurse practitioners to practice in Ontario, they must be registered with the CNO. The Canadian Nurses Association, also known as the CNA, became a federation of provincial associations in 1930. Today, the CNA is a federation of 11 provincial and territorial nursing associations and colleges, representing 148,992 registered nurses. The CNA continues to advance the preservation and interpretation of nursing history by endorsing and supporting Canadian museums and archives to establish a national nursing history collection. The CNA is a voluntary association that nurses can be affiliated with. The Registered Nurses Association of Ontario, also known as the RNAO, represents the nursing profession in Ontario and is voluntary for registered nurses to join. The goal of the RNAO is to foster healthy public policy and encourage the participation of registered nurses in shaping and delivering healthcare services. Nurses who are members of the RNAO help to keep the government accountable to healthcare promises and also help to retain nurses working in the healthcare system. Perceptions of nursing. Nursing is often perceived as a woman's profession. This perception has led the public to inaccurately stereotype nurses. Some misconceptions of the nursing profession include that nurses are seen as subordinate to physicians rather than co-workers, and that nurses are not educated or licensed. The public interprets the role of a nurse in a variety of ways. These include nurturer, caring, physician's assistant, sex symbol, sympathetic, compassionate, and cool-headed. Throughout history, nurses have been viewed as different characters, such as Angel of Mercy, Girl Friday, the Heroine, the Mother Image, and Sex Object. The most common nurse stereotypes include Angel of Mercy, Handmaiden to the Physician, Woman in White, Sex Symbol, Battle Axe, and Torturer. Because of inaccurate portrayals and common misconceptions about the nursing profession, it is not uncommon for there to be a lack of respect for the profession and its professionals, lack of nursing program enrollment, low numbers of men in the profession, and confusion regarding the nurse's professional role. Men in nursing. Throughout history, men and women have been nurses. Examples of men in the nursing role dates as far back as 1629 in Acadia, where men attended to the sick in a type of healthcare facility or sick bay. In early Quebec, Jesuit priests served as nurses, which helped serve their mission to convert Aboriginal peoples to Christianity. Men were also seen as nurses during the Crusades and in the Roman Empire. Today, men make up 5% of the nursing workforce in Ontario and 6% in Quebec. Male students pursuing a career in the nursing field face a variety of barriers, including communication problems, reverse discriminatory practices, gender-based barriers, and a lack of male nursing role models. This being said, the nursing profession is aware of the need for gender balance and diversity, and the barriers and negative influences for men pursuing a career in nursing are beginning to change. This concludes the review for the history of nursing. Thank you for watching, and good luck in your nursing studies.